Commanders tight end Zach Ertz was carted off today with a severe left knee injury. Let's break this down. You're going to see the defender go low on Ertz as he's airborne, and he makes contact with the distal femur, driving it backwards while the tibia and lower leg is going in the opposite direction. This causes a severe hyperextension that might be measured around 45 degrees. Some data show that anything beyond 30 degrees can often tear the ACL and include the PCL. It's important to note that if his foot had been planted on the turf, we'd be looking at a Nick Chubb type knee dislocation here, so while it's fortunate, it's still pretty severe. Ertz initially was helped off the field without having it placed in an aircaster splint, but after evaluation in the blue tent, it's likely they found significant laxity of that knee, and they did end up immobilizing the joint prior to carting him off. Anytime you have a non-planted hyperextension, the knee relies entirely on soft tissue restraints. The defender's force drives the tibia forward and the femur backwards, snapping the joint past neutral. Around 20 or 30 degrees, the ACL ruptures first because it's the primary check rein to anterior tibial translation. Momentum then carries the knee into around 30 to 45 degrees hyperextension, stretching that posterior capsule and loading the PCL, which often sustains at least partial fiber injury. With the foot free to drift into slight varus or external rotation, the posterior lateral corner, which can include the LCL, the popliteus, and PFL, is tensioned, which is why the PLC involvement is common in non-planted hyperextension ACL tears. As the femur rocks backwards, it slams the tibial plateau, creating a bone bruise, sometimes cartilage damage, and even a tibial plateau impaction fracture. At the extreme of 45 degrees, the popliteal artery back here and the tibial and peroneal nerves are tractioned over the posterior femur, creating neurovascular risk even without a fixed foot, which is why he likely went straight to the hospital to rule out potentially limb-threatening injury. Unfortunately, this is likely a multi-ligament injury on that knee, and at the age of 35, data is not as favorable. Average return to play is 11 to 13 months, and his return to play odds is less than 50%. Zach has been one of the all-time best pass-catching tight ends in NFL history, so this is a terrible way to end the season for him. Wishing him a safe and speedy recovery.